We let different patients group into their disease course over time based on their disease activity. And, patients with RA and their outcomes, they're always heterogeneous. There are many possibilities, but we could see clearly there were at least 3, if not 5 groups. There were 3 of the groups were very high disease activity, DAS28 of 6. A couple were lower disease activity, may have been treated earlier, just didn't come up with a severe disease. Then, just thinking about the 3 groups that were severe, about a third of those get methotrexate, and they're super improvers. They're in near remission by 6 months. Amazing. And they stay there. These are we would call methotrexate super responders whose disease gets controlled, as we all wish it would. Another group kind of slowly got there, took a year or so to get there, did quite well, but maybe took too long. Another group didn't improve. They sort of varied a little over time, but they barely got to what we call moderate disease level, which means they are still very active over time, 2 years. And it's not like the docs didn't try and treat them. Everyone got therapeutic doses of methotrexate. Everyone would, in theory, have at least responded quickly, but patients are different coming into our practices, and we can't always tell them apart. There was nothing really obvious. Okay, maybe a few had more comorbidities. Maybe a few had, were immigrants or had some socioeconomic factors. Women always, unfortunately, do worse than men do. And in terms of responding and getting to disease control by a year, which is sort of our first target, ideally remission. And so what we learned is people track differently over the course of time. And as I was saying, the patients who weren't achieving the target, they got steroids, they got steroid injections. They were eventually put on to advanced therapies like an anti-TNF inhibitor. But even then, there was still a group that didn't do well. And we know that if we look far down the road, there's probably 20% of people who start to become non-responders to multi-medications. We also learned that the super fast responders, way less fatigue over time, way less pain over time, way less stiffness. Their function it got better and stayed down. Whereas the group that did not get under control quickly, they had worse function. They never got to normal function. If you could take the retrospectoscope, or you could have all the time in the world to see patients, and as you know, rheumatologists aren't growing on trees these days, you'd need to see them every 4 weeks for the first 3 months and maybe a bit beyond that, because you would see soon that they were not responding as they should. And if you could correct the course, so to speak, earlier, maybe intensify treatment, switch treatment early, that could be helpful. I think the other thing is that patients who in their first year of RA, they're trying to come to terms with having RA. No, I don't have it, not me. He's got to be wrong, she's got to be wrong. I'm sort of very concerned. There's a bit of a denial and anger. It's like mourning. And so it takes some people time to get to the idea that they need long-term therapy. We suspect that for some, adherence might not be perfect early on. Others have side effects. Others were scared off for side effects. The other thing that happens is that there's a point where the cure becomes worse than the disease. So even those who respond quite well start to think around 9 months or a year, do I really need this? And they try stopping and they flare. And then they come to terms with, yes, I need this, but not everybody gets back under control. So, I think the message for rheumatologists is get under control quickly if you can do it. stay in really close touch at the beginning. It is the most critical year, the first year.